It's a little bit like a pap test on steroids. That active stretching is not dissimilar to being in labour. So for anyone who's never had an IUD put in, or if you're the sort of person who's lucky enough to have had it put in under a general anaesthetic and you just wake up and it happens to be there, let me just explain what it is. An IUD is about a 3 centimetre long little plastic device that is designed to both prevent pregnancy, and in some cases they have a bit of progesterone in them that is released slowly and can actually narrow the lining of your uterus and make bleeding go away. So really good for heavy menstrual bleeding. In order to put it in, it's a little bit like a pap test on steroids. So we put in a big speculum that needs to open everything up, and then we need to dilate your cervix using some cervical dilators. So your cervix is the entrance to your womb. There's a little hole in there that if you've ever had a baby, your baby came out that way. So it's stretched to the size of a head, a baby's head. This thing we're trying to put in there is only like a couple of millimetres wide, but we do need to still stretch it. That active stretching is not dissimilar to being in labour. That's what labour is designed to do, is to stretch that little opening of your uterus so that a baby's head can fit out and the rest of the body as well. We don't just deliver the head, just in case anyone was wondering on that one. But it is not a lot of fun. And then once we have dilated your cervix, then we actually use this sort of injector that it's not a needle. It actually just is used to put the Mirena or the other IUD in exactly the right spot. So your doctor will measure how long it needs to be and they put it in exactly the right spot because it's got to be at the top of the uterus, not the bottom. The entire thing can take, if you're really lucky and your cervix dilates really quickly, it can be like 10 minutes. Otherwise, it can be like 20 minutes. It's not a lot of fun.